The deficiency in this nutrient can wreck your sleep, drive anxiety, increase the risk for heart attacks and neurodegenerative diseases, among other things. We're going to be doing a deep dive today into tryptophan, what you need to know about it, where you can find it in your food, how you can supplement with it, and strategies to make sure you never become deficient in this key amino acid. We'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over to Dr. Osborne's Zone. Welcome to Dr. Osborne's Zone. Today we do a deep dive on the amino acid tryptophan. Now, it was first isolated in 1901 by British biochemists Frederick Hopkins and Sidney Cole while hydrolyzing casein, a milk protein. It's an essential amino acid, meaning that we have to eat it. We cannot make it internally, so it has to come from our diet. And one of the biggest core problems today is the war on protein, predominantly the war on animal protein. And what it's done is it's driven a lot of people's diets down in tryptophan. A classic example are the cereals. Scientists right now are working on genetically modifying cereal grains so that they contain tryptophan because it's such a key amino acid and it's so poor in grain-based foods. So we need tryptophan. The best place to get it we'll talk about shortly, but animal meats definitely contain it. Now, why is it so important? It's the sole precursor for serotonin and melatonin. If you haven't heard of these are key neurochemicals that your body and brain use to regulate your circadian rhythm and other hormones and inflammatory pathways. It also can help to produce vitamin B3. It's one of the mechanisms internally by which our body can make vitamin B3. Although it's not a very efficient process, we can still use tryptophan to do it. But it's also the gateway to something called the kynurenine pathway, which helps regulate the immune system and inflammation. So it plays three major roles in these areas, and we cannot make it internally. We have to eat it in our diets. So let's look here at its key functions. So again, the precursor to serotonin and melatonin, about 1 to 2% of the tryptophan that you eat goes to this. And of course, these are neurotransmitters. They regulate circadian rhythm, and then serotonin, large role in regulating how your bowels move. And so a lot of people develop irritable bowel syndrome, whether it's diarrhea or constipation, and this can be one of the primary drivers. It helps to synthesize niacin, and about 3% of your total tryptophan consumption goes to this process. Now, niacin is vitamin B3, sometimes referred to as NAD or NADP. So if you've heard a lot of the hype recently about NAD as an anti-aging supplement, it's just basically vitamin B3 rebranded. But this vitamin is also responsible for cellular energy production inside of your mitochondria and inside of your cells, and for something called redox, reduction oxidation reactions that help maintain the balance within cells and the biochemistry. And then we have the kynurenine pathway, which is where 90+% of tryptophan goes. And this pathway is super critical for regulating the immune function and for protecting your nervous system. And so there are a number of different diseases linked to low tryptophan as a result of the deficiencies that can occur in this pathway. Now, I want to show you a little bit of chemistry here. Bear with me. We'll start with just some general biochemistry, because I want you to understand that when you're looking and thinking about supplementation with tryptophan or in just consuming more tryptophan in your diet, it plays a role in all these functions, but it doesn't play a solo role. Tryptophan needs cofactors, other vitamins and minerals, in order to do what it needs to do. So for example, as you can see here, tryptophan, when we eat it, so this comes from your diet, your body will then take that tryptophan through multiple chemical reactions. And so that's what these arrows and these terms here to the left are delineating. But what I've done is I've tried to simplify the chemistry for you. In kind of a bluish color, I've put the nutrients involved in this. So for tryptophan to convert to 5-hydroxytryptophan requires BH4, which is basically derived from folate or vitamin B9. Now this process here, this chemical reaction also requires iron, which is what Fe is. It requires vitamin D, and it requires vitamin C. So you see, it's not just about eating tryptophan. We also have to eat iron and vitamin D and vitamin C and folate. We've got to get those nutrients in as well. Then the second reaction requires vitamin B6, and that basically, it's just one more chemical, additive to get to serotonin. Once we get to serotonin, we can do all these really key functions. So let's blow this up quickly for you. These are functions of serotonin, and you can see that we have what are called peripheral effects, and then we have what are called central effects. These are the central nervous system, if you will, your brain, right? And peripheral would be everywhere else. So you can see serotonin regulates, in the periphery, it regulates vascular tone, the quality of your blood, the stasis of your blood. Platelets are largely dependent and interactive with serotonin. Cell regeneration, heart function, organ development, intestinal motility. So again, going back to what I was saying before, if you have irritable bowel syndrome, immunomodulation, and others. And then centrally speaking, it plays a role in depression, depression as in preventing it, sleep, aggression. It actually calms aggressive behavior, so we know that people that don't make adequate serotonin or have adequate serotonin in the brain can become too aggressive. Food intake regulates that. It regulates appetite. It regulates the mind. There's now studies they're doing on schizophrenics, which I'll show you, as well as anxiety. So tryptophan to serotonin having these very important peripheral and central functions. And the reason, going back to this diagram, the reason why we pulled this up in the first place was to show you that it's not just tryptophan working by itself, it requires these other nutrients. So B6, we got to serotonin, and then we convert serotonin into melatonin. So this is the end goal if we're trying to have good sleep and the functions of melatonin, and that requires vitamin B5. It requires folate and vitamin B12, and something called SAMe, S-adenosylmethionine. SAMe, in order to make it, our bodies need folate and B12 and the amino acid methionine. So all these cofactors, all these other nutrients are playing a kind of a dance, if you will, a symphony with tryptophan to get to these end chemical products that have so many very important functions internally. But we also, over here, we need zinc and magnesium for this enzyme right here, this N-acetyltransferase enzyme. And so zinc and magnesium, folate B12, SAMe B5, all to get from serotonin down to melatonin. And why is melatonin so important? Let's look at some of its functions. And this class, by the way, we could talk all day about melatonin and its chemistry, but I just want to give you a summary. So here's tryptophan. We get to melatonin. So from tryptophan to melatonin, and what does melatonin do? Well, one of the things it's responsible for is it's one of the most powerful antioxidants in the body. So it reduces superoxide anions. It's basically its antioxidant function. It decreases lipid peroxidation, or the oxidation of fat, which kind of falls in the same category. It inhibits bacterial overgrowth or growth. It's an antibacterial. It induces nitric oxide synthase and helps to express nitric oxide, which is a very potent chemical that dilates your blood vessels and ensures that your blood vessels can deliver oxygen and nutrients to your tissue. It has an anti-inflammatory effect. It also reduces chemicals like interleukin 6 and 8 and TNF-alpha. These things are predominantly excreted when there's a severity of damage or inflammation in the body. It inhibits a chemical called myeloperoxidase, which causes inflammatory damage. So you can see a lot of this is antioxidant or anti-inflammatory in nature. Diseases linked to poor melatonin, inflammation, Alzheimer's, Parkinson's, high blood pressure, obesity, cancer, diabetes, sepsis, and autoimmune disease. So we need melatonin, but we can't make it if we don't have tryptophan. Tryptophan is the rate-limiting ingredient necessary for the production of melatonin. Okay, let's talk about some of the symptoms associated with deficiencies in tryptophan. So we've broken these up into kind of categories, if you will. Over here on the left, you can see earlier onset symptoms generally lead to irritability, poor sleep, and sugar cravings, along with headaches. So if this fits you, and this fits a lot of people, you might think, number one, am I getting enough protein in my diet? Because generally speaking, as I mentioned earlier, it's protein. Protein is where the bulk of this is going to come from. And maybe you are. Maybe the answer is yes, I'm getting enough protein. Then you have to start asking the question, well, am I getting enough of those other nutrients that help tryptophan to produce melatonin, because melatonin is playing the role in a lot of these symptoms. And so are you getting the B vitamins? Are you getting the zinc? Are you getting the magnesium and the C and the D and the iron, right? All these become necessary to take tryptophan and make melatonin. So if you are getting enough protein, think micronutrients. Now, if we get a progressive deficiency, so this has been going on for a longer time, we're going to have the symptoms are going to take a step up. We're going to get depression, anxiety, impaired cognition. We know that that tryptophan deficiencies play a role in how we remember things in our long-term memory banks. Intermittent skin rashes and swelling of the tongue or glossitis can also occur. Now, if we get severe, we can get pellagra-like symptoms. Pellagra would be, if you're not familiar, I said earlier that tryptophan makes vitamin B3. Vitamin B3 deficiency is called pellagra. It's the name of the disease linked to vitamin B3 deficiency, but with tryptophan deficits, we can get pellagra-like symptoms. That includes what's oftentimes referred to as the 3 Ds of pellagra: dermatitis, 3 Ds because they all start with the letter D, right? Dermatitis, diarrhea, and dementia or cognitive decline. Now, if you're a child, and we've seen this clinically, children where parents are trying to take their kids on vegan diets, which is a horrible idea for kids, you get stunting or impaired growth and weight gain, blunting of growth hormone production. So if you've ever taken your child to the doctor, to maybe the endocrinologist, and they've said, your child's not making enough growth hormone, think tryptophan. Get the levels measured. Ask the doctor to measure tryptophan to make sure that that's not playing a role in a reduction of growth hormone. There are other amino acids that can do that as well, but tryptophan is a major one. Okay, let's talk about diseases linked to tryptophan deficiency. I mentioned before IBS, or irritable bowel syndrome, and that has to do with serotonin and its regulatory effect of the gut, but also inflammatory bowel disease, and that has to do with that kynurenine pathway that we were talking about that is, it regulates immune function and inflammation. And then two, we haven't really talked about it, but the bacteria in your gut, they can metabolize tryptophan. And they metabolize tryptophan into a variety of different compounds that have regulatory effects on the bowel from that inflammation. So your gut bacteria become very important, and this is where sometimes when we're seeing people who maybe they've been on an antibiotic or other gut depleting medications, and it disrupts their microflora. It leads to potential reduction in the production of many of these compounds that are supposed to help regulate the bowel. We know some of these compounds prevent leaky gut because they play a role in the mucin or the mucus production of the GI tract lining. So it's important context there to understand that the inflammatory bowel component can have to do with the bacteria and the interaction between the bacteria and tryptophan. There's also something called immune crosstalk, where the bacteria produce compounds that communicate with the GALT, the gastro-associated lymphoid tissue within the gut. Okay, we also have major depressive disorders. As we mentioned before, serotonin and melatonin can both play a role here in that pathway. Insomnia or lack of sleep, that has mainly to do with melatonin, as well as cardiovascular disease. That goes back to the inflammatory regulation, and then the neurodegeneration that occurs within the brain itself. So this image kind of helps us to understand the neurological degeneration pathway of tryptophan deficiency. So what we're looking at here, it's kind of a complicated diagram, but here's tryptophan. And I told you earlier there's a pathway where tryptophan goes and it makes a bunch of different metabolic byproducts. This is called the kynurenine pathway. That's that word right there. And so as a general rule of thumb, you see this red box, I'm going to just draw a square around it. These different chemicals are byproducts of this pathway. And if we build up too much of these compounds, especially QA and xanthurenic acid, then these compounds have neurotoxicity, oxidative stress. They can create damage to nerve tissue. We don't want high levels of these compounds. And so it's very important that when we're thinking about tryptophan, maybe some of you are already thinking about, should I be supplementing with tryptophan? If you're going to do that, you see these little yellow circles throughout this pathway. Those represent vitamin B6. You can see one over here, here, and here. So vitamin B6 is critical for many of the metabolic steps involved in breaking tryptophan down. Where the ultimate goal is to make this substance right here, kynurenine, but also to make this right here, which is vitamin B3. If you don't have adequate B6, you can get trapped in some of these toxic compounds which have neurotoxicity effects. So it's very important to make sure that you're getting adequate B6. Now, the wonderful thing about eating animal protein is it contains a lot of tryptophan, but it also contains a lot of vitamin B6. It's where we get most of our B6. Mother Nature puts it together on purpose. She knows that where you have one, you need the other for it to work properly. So the neurodegeneration of tryptophan deficiency largely tied into the byproducts of some of these chemicals produced by metabolizing tryptophan, where you get stuck. And you don't want to get stuck. Getting unstuck requires vitamin B6 to a large extent. So keep that in mind. Okay, let's move into some of the studies that have been shown or done on tryptophan in humans, and some of the benefits of using tryptophan in humans. So we see here depression, cognitive function, sleep quality, gut immune balance, migraine sufferers, chronic pain and chronic inflammation. There's been research on all of these things. I'm going to pull some of these studies up for you, and we'll just talk about a few. Here we go. Let's dive in. So you can see here tryptophan. These all come from a large review paper on research done with tryptophan, but tryptophan's been found to be as effective as tricyclic antidepressants in a number of trials, references here. And one study found that the effects of tryptophan and amitriptyline alone and in combination were all superior to placebo. So as effective, I love this because a lot of times you'll hear doctors say, oh, that nutrition stuff's nonsense. It doesn't work as well as medications. And there's so many examples of studies where natural agents work as good as drugs and sometimes better, but in this case, as effective as tricyclic antidepressants for the treatment of depression. Here is a nice review on the role of tryptophan metabolites in neuropsychiatric disease. And you can see several different types of conditions. The condition listed here on the left. TRP stands for tryptophan. So tryptophan supplementation significantly declined the number of events that needed intervention. And here we're talking about schizophrenia. You can see tryptophan supplementation improves mood and decreases hallucinations in patients. So if you know somebody with schizophrenia struggling, you may talk to them about tryptophan. Supplementation could considerably decrease aggressive, pugnacious behavior without any impact on mood or agreeableness. We know that tryptophan supplementation enhances dominance, helpfulness, and affiliative responding. This is for mood disorders. And for hypomanic disorders, disease improvement after receiving tryptophan supplementation. Sleep disorders, tryptophan supplementation possesses excellent potential to decrease the latency to sleep as a hypnotic for chronic insomniacs. I know in my own practice, when we have people that are struggling to sleep, tryptophan is one of the first things I pull off the shelf. Of all the sleep aids that I've ever used clinically, I haven't found one really that's more helpful than tryptophan in non-habit forming, because a lot of the sleep aids, like if you've used melatonin as an example, you'll wake up groggy the next day or kind of out of sorts. Tryptophan supplementation doesn't do that. If you're using something like valerian or chamomile, if you take too much, those can make you groggy the next day or lethargic the next day. Tryptophan doesn't do that. So as a general rule of thumb, in my opinion, it's one of the safest things to take to help with sleep with virtually no side effects. So anyway, back to this. So mild depression, tryptophan supplementation, significantly effective in treating mild depression. So this, again, just a research review of numerous human studies on tryptophan. And then we have here, you can see tryptophan has been used successfully in the treatment of seasonal affective disorder, what they oftentimes refer to as SAD, seasonal affective disorder, and maybe as effective as light therapy. In one study, who met a DSMV criteria for recurrent major depressive disorder with seasonal winter patterns, treated with light therapy for 2 weeks. The treatment for those who were partial or non-responders to this light therapy were then augmented with tryptophan. The dose was 3 grams a day for 2 weeks, and they found tremendous improvement in the 3 gram a day dose. Half of the patients showed significant improvement during both treatments, regardless of the order of the treatment. So light therapy worked well, tryptophan therapy worked well. So think about this. If you live in the north and you struggle every winter with this, ideally you want to think about a light box that you use during the winter months. You can get one of these. You can buy these at local retailers. You can buy them on Amazon. They're relatively inexpensive, generally around $80 in the US for a good, what's called a 10,000 illumination box or 10,000 lux. If it's that strength, it'll work really well in the winter to prevent depression. But then you can consider coupling that with tryptophan. 3 grams a day was the dose used in this particular study. I've seen it be effective in people everywhere from 1 to 3 grams a day. Some people do better at higher doses. Some people don't need quite as much. Another study down here, Steinberg and colleagues conducted a randomized double-blind placebo-controlled trial to assess the efficiency of tryptophan. They were using 6 grams a day, and they were treating premenstrual dysphoric disorder. Basically, we're treating premenstrual problems. And so patients receiving tryptophan reported significant reduction in dysphoria, reduction in mood swings, and in irritability compared with those receiving placebo. So it worked really, really well for women with premenstrual problems. And going back to, you can use 6 grams of tryptophan. You can eat tryptophan in your diet. It's very easy to eat more tryptophan. So those of you struggling with these psychiatric problems, consider how much protein are you getting on a daily basis in your diet, and of the protein that you're eating, how rich are the tryptophan sources of protein. We're going to come to food in just a minute, but I want you to always consider that as a precursor to supplementation, because food is easy. Food, we can just add it to the diet and we can a lot of times knock it out. We've got here, in patients undergoing smoking cessation, tryptophan at 50 milligrams per kilogram per day has been used in combination with high carbohydrate diets and is reported to reduce anxiety and severity of withdrawal symptoms. So if you're trying to kick a habit, you may consider looking at tryptophan as an aid to that, and to improve abstinence or reduce the number of cigarettes smoked. So smoking cessation, tryptophan had benefit. We have this study on tryptophan. Elderly often suffer from sleep disorders and depression, which contribute to mood disorders. In our previous work, we showed that elderly individuals with mood disorders had lower intake of tryptophan. And we see this a lot. Elderly, as you get older, you eat less. There's a pattern. When you eat less, your stomach shrinks. Your stomach shrinks, you want to eat less. But ultimately, what's really low in the elderly is protein as a whole. And this is one of the reasons why the elderly start to develop sarcopenia or muscle loss and bone loss as they age. It's not really an age decline so much as it is an eating less leading to shrinking of the stomach, leading to reduced protein, etc. It's kind of a pattern that just pushes that person over the edge. But it also affects the mind, because the mind needs protein. Remember, all the neurotransmitters are derivative of proteins. The mind needs protein to get to them. So in this case, we assess the impact of tryptophan-rich diet on the mental state of depression and sleep disorders and an equal number of elderly subjects without mood disorders. In conclusion, dietary consumption of adequate amount of tryptophan has a beneficial effect on mental health of the elderly with mood disorders and improves metabolism of this amino acid. Therefore, tryptophan-enriched diet may be considered as a component of the treatment of elderly individuals with mood disorders. How many of you have an elderly loved one who doesn't eat enough, especially doesn't eat enough protein? Or maybe they've had a nutritionally ignorant doctor who said, don't eat the animal protein, it increases your cholesterol, makes you have heart disease. All that nonsense rhetoric we've been suffering through from people who don't understand nutrition. And now we're at this, we see our elderly at this state in their life where they're just wrecked as a result of bad dietary advice. Okay, you can see here, kynurenine is known to be involved in acting as an ultraviolet filter which protects the retina of the eye from UV damage. So this is, remember we were talking about the kynurenine pathway? So tryptophan makes the substance kynurenine, and this substance protects the eyes from ultraviolet light. And they believe that it may, in some individuals, play a role in cataract formation when you don't have that protection. So there's the thought that tryptophan actually protects the eyes from excessive UV photooxidative damage. Some of you were asking about cataracts in a recent show, and maybe that information's helpful for you. You see here, tryptophan has been used for the treatment of sleep disorders and is thought to produce its therapeutic effects through melatonin mechanisms, as we said earlier, melatonin mechanisms. Improvement in sleep latency has been reported with doses as low as 1 gram. This is what I usually put people on, is 1 gram. Usually you start with 1 gram per night, and you take that about 30 minutes before bed as you're trying to support that sleep. An important feature, actually, let me back up here. Improved sleep for sleep has been reported with doses as low as 250 milligrams. An important feature of tryptophan treatment is that, unlike many other medications administered for sleep disorders, it does not limit cognitive performance or inhibit arousal from sleep. Tryptophan also produces significant improvements in obstructive sleep apnea. So, if you've been diagnosed with this, not central sleep apnea, but obstructive sleep apnea, if you're overweight and you struggle breathing, tryptophan can help you sleep better. So 2.5 milligrams of tryptophan administered effectively helped people with obstructive sleep apnea. So giving you the dose there too, you can do with that what you will. There are some considerations we'll talk about here in a moment. If you're going to supplement tryptophan, some things you should just be aware of. So here we have, in this particular study, where they were looking at the effect of a tryptophan-rich breakfast. So this wasn't supplementation. This was just simply eating foods higher in tryptophan at breakfast, along with light exposure during the daytime. And so here's what they found. The study is the first to report the quantitative effects of changed tryptophan intake at breakfast combined with daytime light exposure on melatonin secretion and sleep quality. Evening saliva melatonin secretion changed significantly and indicated that a tryptophan-rich breakfast and bright light exposure during the day promoted melatonin secretion at this time. So we want that. That's how we go to bed at night. And in this case, the amount of tryptophan rich in the diet was 476 milligrams in the meal. So, if that's mainly a serving of meat. If you really want to think about it in that way, how many kids are eating breakfast cereal? How many adults are eating breakfast cereal, for that matter? Mostly cornflakes or other poor nutritive value, low protein, low tryptophan value foods at breakfast for their primary meal. Okay, let's talk about foods rich in tryptophan. We've got several on the list here. All meat and poultry. We've all heard that. I assume many of you have heard that turkey, at Thanksgiving makes you sleepy. This is one of the reasons why. Tryptophan helps with serotonin and melatonin, which helps improve sleep quality. But also chicken, pork, and beef are rich. Most versions of fish protein are fantastic sources of tryptophan as well. Eggs, cheese, yogurt, and milk. If you're following me for any length of time, if you're doing dairy, because dairy can mimic gluten, so you got to be careful if you're gluten sensitive on this one. My suggestion is play caution around dairy unless you've worked with somebody to rule it out. And if you're going to do dairy at all, my advice is make sure you're using an A2 grass-fed, grass-finished dairy, so that you get a good quality dairy and you're not getting the chemicals and the hormones and the casein, the A1 casein that we know can drive autoimmunity. And then from a legume perspective, tofu, lentils, and chickpeas are good sources, although I'd be very cautious here because a lot of the soy, which is where tofu comes from, is GMO and has the potential for contamination of glyphosate, as do other lentils. I think it was a recent study showed that these foods, if you don't buy them organically, had the highest concentration of glyphosate in them of all other foods tested. So you definitely want to consider here, you want to make sure you're getting organic. Because remember what we said earlier about the bacterial relationship with tryptophan. The bacteria can metabolize tryptophan, but glyphosate acts on the bacteria. It acts as an antibiotic on your gut, and it decimates the microbiome as one of the potential side effects. So you don't want to get that in you. It's going to disrupt the potential of your metabolic pathways around tryptophan. And then nuts and seeds, pumpkin and squash seeds, both very good sources dietarily of tryptophan. So all these things you can eat. You can get a good amount of tryptophan in your diet on a regular basis by just eating these healthy whole foods. Where I've seen a lot of tryptophan deficiency in my experience when we test people is they're on plant-based diets or they're vegans, and so they're just low as a whole. Now that doesn't mean I haven't seen tryptophan deficiencies in meat eaters too. It's unique for the person, and it's always better to test and not guess. But nonetheless, the greater risk we see clinically is in plant-based diets. So let's talk about if you're considering supplementation, let's talk about a few things as far as side effects. I will say this, I'm listing these side effects here mainly because I just want you to be aware of potential possibilities. When it comes to nutritional supplementation, especially as you get the doses up really high, and when I say high for tryptophan, if you're 1 to 3 grams a day, you really relatively don't have to worry about any of these things. It's not common at all. It's one of the most well-tolerated supplements I've used over the years. So it's when you start getting into the heavier doses, really 5+ grams a day. I don't recommend you go over 5 grams a day without working with a doctor if you're looking to push your dose. But some of the side effects at higher doses they're listed here, GI side effects like heartburn, stomach pain, belching and gas, nausea, vomiting, diarrhea, and loss of appetite. Neurological side effects like headaches. And this has to do with especially if you are taking it and you're not getting enough vitamin B6 or vitamin B2, because remember I showed you earlier those pathways for how it's metabolized. Some of those byproducts can be neurotoxic, and this is where some of this can come from. So headaches, lightheadedness, drowsiness, and fatigue, blurred vision, dizziness, muscle weakness, stiffness, and loss of coordination, and then tremors. There's a condition called serotonin syndrome right here. This potentially dangerous condition can occur when tryptophan is combined with medications. So this is where there's a caveat. If you're on any of these types of medications, you need to be working with the doctor if you're going to attempt to take tryptophan, and need to be monitoring for these things. But if you're on an SSRI to treat your depression or on a Mayo inhibitor to treat your depression, you've got to just be aware. Generally, 1 gram or less a day is well tolerated, even if you're on an SSRI or a Mayo inhibitor. But nonetheless, everyone's different. Be cautious. If you're on tramadol or meperidine, be cautious. Symptoms can include extreme anxiety, being easily startled, rapid heartbeats, delirium, severe muscle spasms, and increased body temperature. So pay attention to those things. That's not a good situation to get in. Now, obviously, if it happened to you because of tryptophan supplementation, you'd obviously want to discontinue it right away and talk to your doctor. But it's a pretty rare side effect. So I don't want to scare anyone away from the potential benefits of tryptophan over a rarity of this side effect. You can see here, this was out of the Journal of Nutrition. Occasional side effects seen mainly at higher doses, 70 to 200 milligrams per kilogram a day, which is a very high dose, include tremor, nausea, dizziness, and may occur when tryptophan is taken alone or with a drug that enhances serotonin function, such as antidepressants. This is what we're just talking about, serotonin syndrome. I want to point out there was in 1989, they talk about, you see here in 1989, a new syndrome appeared. No, it didn't. There's no new syndrome. This actually, in my opinion, set nutrition science back decades. Because the new condition, they called it eosinophilia myalgia syndrome, which is, just excuse my language, was BS. What this was a contaminated batch of tryptophan from one company. So one company had a contaminated batch. It was a big company, And so people taking it from this particular company developed high levels of eosinophilia and myalgia, muscle pain, and it was being reported all over. And it was, after it was investigated, it was an impurity formed in the manufacturing conditions from this one company. It had nothing to do with tryptophan. So if you have a doctor that's ever tried to scare you away from tryptophan, saying it causes eosinophilia, myalgia syndrome, it's because they don't read the literature. This was a widely publicized and widely investigated event, and it's not a side effect of tryptophan use. It's a side effect of the contamination of tryptophan that occurred by a single company's manufacturing process. So be aware of that too, because there's a lot of people get online and they read, you read from some of the big sites, some of the main sites, and they talk about eosinophilia, myalgia syndrome as a side effect of tryptophan, but then they don't put that tidbit of history in to kind of let you have the whole truth. They give you the half-truth to scare you away from using it. Let's talk about lab testing for tryptophan. You can get tested, but normal reference range for adults, about 21 to 108 nanomoles per milliliter if you're testing serum. I don't recommend serum testing. It's not super accurate, and it can change from day to day. I'm a big fan of INA, intracellular nutrition analysis. If you don't know what that is, you can go to, we'll put a link below this video for you. You can go to my website and read more about it. But it's a type of intracellular testing that measures for adequacy of the nutrient and whether or not your cells are functioning. Okay, let's talk about, actually let's move this over here. I want to talk about, we broke this down a little bit earlier. I said that when you're thinking about tryptophan, you really want to think about the nutrient cofactors that play a role with it. And I showed you some of these diagrams already, just as a kind of a reminder again. We take dietary tryptophan, and our goal is to be able to make serotonin in the gut. 95% of the serotonin in the gut is made by this pathway. And we also want to make melatonin. So these are the two, think of these as the two most important byproducts of tryptophan as far as your nervous system is concerned. And in order to do that, so if you're, my point is, if you're supplementing with high doses of tryptophan, but your vitamin D levels are low, or your vitamin C levels are low, or your B6 is low, or your folate is low, or your iron, or your methionine levels, or you have low zinc or low magnesium. These are all cofactors that play a role in getting tryptophan to serotonin and melatonin. So it's super important to understand that. I get this all the time where people will try, they'll try it and they'll say it didn't work, didn't help me sleep, and lo and behold, they had a deficiency in a cofactor. So if you've tried tryptophan and it didn't really help for you, you might consider nutritional testing to see if you have cofactor deficiencies that are preventing your tryptophan from going through its biochemical process efficiently. So we've got that, and then I wanted to show you a few other things here that we haven't yet talked about, and this has to do with tryptophan in your brain, because they're now studying how tryptophan is very crucial for especially kids with attention deficit, or people with high anxiety, or people that have kind of an impulsivity or behavioral problems. Tryptophan has to be converted, as I've already shown you. The first step is this substance called 5-HT, 5-hydroxytryptophan. You see this enzyme right here, and this is in the brain. So this is how it's done in the brain. This enzyme requires vitamin D. A vitamin D activates this. So if you have good levels of vitamin D, then you can convert tryptophan to 5-hydroxytryptophan, and then so these are nerves. This is a nerve bouton. If you don't know what that is, it's the end of a nerve. So this nerve is talking to this nerve by way of 5-HT. through these receptors. And so this is how nerve propagation messages occur. And so you want this nerve to be able to communicate to that nerve, but in order for that to happen, you've got to be able to convert that tryptophan into 5-HT, and that requires vitamin D. So, and then if all that's working well, then you get normal executive function, normal sensory gating, and pro-social behavior. Now, if you don't have enough vitamin D, you get poor executive function, poor sensory gating, and impulsive behavior. So vitamin D is a requirement right here. The other thing that you need, though, for these membranes to work properly and for them to open properly through this mechanism and channel is you need high EPA and high DHA. What are those? Those are omega-3 fatty acids. Where do we eat? Where do we get the bulk of omega-3 fatty acids? Either from cold water fish or from beef, particularly grass-fed beef. Vegan sources of omega-3 are pre-omega-3. Technically, they're not omega-3. They're pre-omega-3. The body still has to convert them. So we see a lot of kids today eating high carbohydrate diets, 60, 70, 80% of their diet's carbohydrates. It's not even just kids, it's adults too. And they're not getting enough of these nutrients. Where do we get vitamin D? Well, we get vitamin D from organ meats predominantly. You can get some from mushroom as well, but you also get it from sunshine. And so it makes for one more, I think, very important conversation around tryptophan and its ability to convert. If you stay inside all day, and most people do, we spend 90% of our time indoors. We're not getting the sunshine that we need. I showed you earlier a study where combining tryptophan plus sunshine led to a better outcome. We need the sunshine. The sunshine's important for the vitamin D, for the regulation of the vitamin D, which helps to convert this neurotransmitter and activate it. So it's not just vitamins and minerals, it's also sunshine. It's not just vitamins and minerals from food, it's also sunshine, and that's going to be a behavioral component for you. So, bottom line, you can eat your tryptophan from protein, you can activate it with adequate nutrition and sunshine. If you're looking to supplement, what you want is something called L-Tryptophan. And typically start around this dose. This is a real safe, and that's per day. If you're taking it for sleep, take it before bed at nighttime. If you're taking it for anxiety to see if it helps kind of calm your nerves, so to speak, you can take it throughout the day. It will not make you sleepy. That's one of the benefits of tryptophan is it doesn't cause grogginess. So 500 milligrams, generally 3 times a day, TID, is a good place to start if you're looking at supplementing and you just needed a starting point. So 500 milligrams 3 times a day for general things, the general things that we talked about. If you're looking for more therapeutic doses, you can go as high as 3 grams in a day, relatively safely, unless you're taking certain types of medications like we mentioned. And if you are, work with your doctor, be cautious around it. If your doctor's not educated in tryptophan too well, then get you a nutritional doctor that is, and work with him or her. But this is generally where you want to stay. As I want to emphasize food first. If you're on a low protein diet, food first. A lot of times that resolves the issue. If it doesn't, then you can consider supplementation. So there you have it. Crash course on tryptophan. Hope this was helpful for you. Do me a favor, we're trying to save 100 million lives. You found this information helpful, hit that like button below, and make sure you share this information with somebody else who could use it. Have a fantastic day, and we'll see you on the next Dr. Osborne Zone. Take care. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.